Hi, my name is Erin Sowers. I'm a BSc in nursing student at Bluefield State College. This presentation I present to you is about the communicable disease Ebola. Ebola was once known as the Ebola hemorrhagic fever. It is a rare but severe and potentially fatal disease. The disease is reportable to the National Notifiable Disease Surveillance System in all U.S. states and territories. Ebola is caused by one of the 5 Ebola viruses, which are found in several African countries. The virus was first identified in 1976, and since then there has been over 20 Ebola outbreaks throughout Africa. The 2014 Ebola epidemic is currently the largest Ebola outbreak in history. As of November 7, 2014, there has been 8,168 confirmed cases and 4,960 deaths. Prior to the 2014 epidemic, the largest outbreak recorded occurred in Uganda during the years of 2000 and 2001, noting 425 cases and 224 deaths. The natural host of Ebola virus remains unclear. However, researchers tend to believe that the virus is animal-borne, and fruit bats are the most likely reservoir. Once the virus is transmitted to humans, the disease is easily spread from human to human via direct contact. Broken skin or unprotected mucous membranes, such as eyes, nose, or mouth, are portals of entry for infected blood or body fluids, including but not limited to feces, urine, saliva, vomit, sweat, breast milk, and semen, and contaminated objects such as medical equipment or needles, and infected fruit bats or non-human primates. Ebola is not airborne nor spread through water. In general, Ebola is not foodborne. However, in Africa, there is a connection between Ebola and bushmeat. Bushmeat is any wild animal hunted for food, such as bats, non-human primates, such as apes or monkeys, cane rats, and antelope. These wild animals can be contaminated with germs, including the Ebola virus, making it risky to handle or eat. African bushmeat is illegal in the United States, and any individual who brings bushmeat in the U.S. will be fined. Individuals infected with the Ebola virus are contagious from the moment symptoms appear until recovery. The virus can stay in semen up to 3 months, and the individuals who die with Ebola are still infectious post-mortem. The incubation period of Ebola is 2 to 21 days, with the average of 8 to 10 days. Symptoms begin with a sudden onset of fever and malaise, accompanied by other nonspecific signs and symptoms such as severe headache, fatigue, muscle pain, and weakness. These symptoms are followed by a GI phase with abdominal pain, diarrhea, and vomiting. The liver, pancreas, and kidneys may also become involved, leading to hepatic and/or renal failure. In the last stages of the disease, there are unexplained hemorrhagic features leading to hypovolemic shock and possibly death. The fatality rates are as high as 90%. The fatality rate of the current Ebola epidemic is 60.72%. Long-term complications experienced by those who recover include joint and muscle pain and vision problems. Furthermore, if a patient presents with a fever and has had a recent travel history or a risk of exposure to the Ebola virus, a diagnosis is made based on a thorough patient history and routine blood tests and virus isolation. There are several diagnostic tests available to help diagnose Ebola, including the antigen capture, enzyme-linked immunosorbent assay, also known as the ELISA test, and the polymerase chain reaction, known as the PCR test, the IgM and IgG antibody test, and immunohistochemistry testing. The choice of diagnostic test depends on the timeline of infection. Unfortunately, there is no FDA-approved vaccine or treatment available for Ebola. Patient care is supportive, and symptoms are treated as they appear. Interventions include IV fluids and electrolyte management, oral and IV nutrition, maintaining oxygen status and blood pressure, treating other infections as they occur, and symptom control with medications such as antipyretics, antidiarrheal, antiemetics, analgesics, and anti-anxiety medications. The population most at risk is healthcare workers and family and friends of patients infected with Ebola. Standard contact and droplet precautions are recommended to prevent transmission of Ebola in the hospital setting. The patient should be quarantined in a single patient room with a private bathroom. Personal protective equipment includes mask, gown, gloves, and eye protection. Additional precautions need to be taken during aerosol-generated procedures, including airborne precautions with negative pressure rooms and PAPR or N95 respirator with a full face shield, helmet, or headpiece. And always practice hand hygiene. After isolating the patient, the disease or suspected disease is immediately reported to the hospital's infection control program. It is important for nurses to be knowledgeable about this communicable disease so that the disease can be prevented, detected early, and early treatment, and therefore better patient outcomes. Nurses play a vital role in the prevention of disease. Primary prevention is the prophylactic measure taken to prevent transmission of disease. The community health nurse may educate the community about the importance of hand hygiene, avoiding unnecessary travel to West and Central Africa, and avoiding contact with anyone infected with Ebola virus. Furthermore, secondary prevention is the second level of prevention in which the goal is early detection of the disease. Identifying the disease early allows for early treatment and therefore reduces complications and minimizes the spread of the disease. Interventions include within the secondary prevention include screening, diagnostic tests, contact tracing, and early treatment. Screening for Ebola includes temperature checks. Anyone with an elevated temperature must be directed to seek medical attention. Contact tracing is a procedure in which all contacts of an infected individual will be traced back to the length of Ebola's incubation phase of 21 days. The last level of prevention is tertiary prevention. Tertiary prevention is when the nurse provides rehabilitation, counseling, and/or grief support for the patient. Long-term complications experienced by the patient who recovers Ebola may include joint and muscle pain and vision problems. The nurse may provide tertiary prevention by implementing physical therapy rehabilitation. On the other hand, because Ebola is potentially fatal, the nurse may provide end-of-life counseling and grief support for the patient and/or family. Thank you for listening, and for more information, check out the CDC website.